Hello, my name is Mayra Kilbeli Feliz Terrero, and today I'm going to talk about and explain surgical treatment. We are going to understand surgical treatment, how it is performed, the tools that are used, and the standard procedures followed in the operation theater. The operation theater. Surgical procedures take place in a special room called the operating theater. To avoid infection, the environment must be completely sterile. The surgical team wears protective clothing, including gown, gloves, and a mask in the face. The patient's skin is clean with antiseptic and covered with sterile drapes to expose only the area to be operated on. Interdepartmental collaboration. Here are some basic surgical instruments that we are going to use in the future. The first one, the scalpel, is right here. The scalpel is used to make precise cuts. Um, the artery forceps, there you go, help stops bleeding by clamping blood vessels. We have the recepting forces are used to grasp or move tissues. We have the scissors are used to cut tissue or sutures. The retractor holds back tissues to expose the surgical area. We have the operation process. Every surgery starts with an incision. Bleeding is controlled with a swab or a sucker. This is a device that suctions the blood. Blood vessels can be tied or sealed using diathermy. A drain may be inserted to prevent fluid accumulation. At the end of the surgery, the wound is closed using sutures, staples, or both, and covered with a dressing. An operation report. This is an example that we have in the book and says this patient had an indirect right inguinal hernia, anesthesia, spinal anesthetic with local anesthetic infiltration, and the incision is right inguinal. Procedural. The external oblique aponeurosis was divided. We have that word in black to do emphasis. And the spermatic cord mobilized. The hernial sac was identified and separated from the spermatic cord. The hernial sac was then mobilized back to its neck, where it was transfixed, and the region to the excised. The fascia at the neck of the spermatio cord was divided, carefully preserving the vessels, the genital branch of the nerve, and the vas deferens. Three thereafter, the posterior wall of the inguinal canal was repaired in two layers. For closure, the one was closed in layers with the suture material to the external oblique aponeurosis and stapled to the skin. This is an example um, that we have in the professional English. And to conclude or to finish my presentation, surgical treatment is a complex but essential medical procedure. It requires a sterile environment, a specialized instrument, and a clear surgical technique. Understanding these elements helps a healthcare professional communicate accurately and provide better patient care. Thank you so much for listening. It was all for my part. Have a nice day. Bye bye.